Dear students, today we have its lecture, chronic diseases of the digestive system. Chronic gastritis, gastroduodenitis, peptic ulcer diseases. They are polyfactor and heterogeneous diseases due to impair neuroendocrine and immune system, the imbalance between the local factors of aggression and protective, and a violation of regeneration and damage to the mucous membrane of the stomach and duodenum. The structure of diseases of the stomach and duodenum. In the structure of gastrointestinal pathology in children with chronic gastroduodenal diseases account for 76% of them. Functional digestive disorders about 25 to 30%. Chronic gastroduodenitis from 40 to 45%. Chronic gastritis is 4%. Chronic duodenitis is 2%. Peptic ulcer and duodenal ulcer from 5 to 6%. The peak of incidence, the period of the most intestine, morphological and functional change in the child's body from 5 to 6 years and from 9 to 12 years. The reasons for the growth of diseases of gastrointestinal tract. Social factors. We have its three groups factors: social factors, medical factors, exogenous, endogenous factor, and infection factors. First groups factors: unfavorable ecological situation, psycho-emotional wallet, artificial feeding and mismatch of food, the child age and balance on the basic food ingredients diet, and hypocalcemia. Medical factors: intestinal infection and helminthic infection, allergic diathesis, family predisposition, congenital enzympathy, surgery of the gastrointestinal tract, wrong and irritational medication, malformation of the digestive system. Next, groups factors is exogenous factors, poisonous and acute intestinal infection, prolonged violation of the regime and quality of poor supper, eating food that irritated the gastrointestinal mucosa, food dry, the shortage of food nutrition necessary for physiological regeneration, irritational medications, neuropsychiatric overload. Next, endogenous factors. Neuroreflex effects of the stomach and duodenum from other affected organs of the gastrointestinal tract. Diseases of the cardiovascular system, kidneys, endocrine system, diseases of the blood. Chronic center of infection, helminthics, dysbacteriosis of intestinal, duodenal, gastric reflux. Next, infection factors. It's a Helicobacter pylori infection and microaerophil gram-negative oxidase and catalase bacteria. Currently, infection more than 40 strains of Helicobacter pylori with different pathogenesis sensitive to antibacterial drugs. The pathogenesis of inflammatory diseases of gastroduodenal system. We have its two groups: factor of aggression and factor of protection. Factor of aggression, acid peptic factors, trauma, violation of gastroduodenal motility, the action of bile acid, Helicobacter pylori infection, and drugs. Next, factor of protection, smiley gel, active regeneration, sufficient blood sampling, intraduodenal acid break, development, bicarbonate ions. Classification. We have its form: acute form, chronic form, particular form, eosinophilic, lymphatics, granulomatous, radiation, ischemic. Etiology: Helicobacter pylori positive, Helicobacter pylori negative, autoimmune, reactive or chemical ascension. Next, by localization, antral, fundal, and pangastric. Endoscopy appearance, atrophic, hypertrophic, superficial, erosive. And secretion function, normal secretion, hypersecretion, and hypersecretion. Period of the diseases. We have its three period, exacerbation period, subremission, and remission. Next, clinical form, ulcer-like, gastritis-like, cholecystics-like, pancreatitis-like, and pseudo-appendicular. Clinical syndromes. We have its next clinical syndromes. It's a chronic intoxication. Next, it's a pain syndrome. Next, it's a dyspeptic syndrome. And next, it's asteno-vegetative syndromes. Method of diagnosis of Helicobacter pylori infection. We have its histological method, microscopy method, bacteriological method, biochemical method, serological, molecular biological method, and respiratory method. Thank you for your attention.